Hello, I'm Carly, one of the safeguarding consultants here at Education Child Protection. This week's safeguarding briefing update is in response to the COVID-19 pandemic and its effects upon children and young people's mental health. As a practicing counsellor for both adults and young people myself, I'm all too familiar with the stresses and frustrations from people being able to currently access specialist mental health provision. The wider effects of the pandemic and nationwide lockdowns on children and young people have arguably been greater than the effects of the COVID-19 infection itself. Despite being much less at risk of hospital admission from the virus, the youngest members of our society have not escaped this time unscathed. And research in how this disruption on their access to school, leisure and significant relationships will affect them long term is currently being explored by a number of providers. We are seeing an increasing referrals to student services teams in schools or pastoral support, as well as formalised school counselling services. And this highlights the growing problem of often very long waiting lists for young people to be able to access national or regional mental health provision, and the subsequent expectation therefore upon schools to be able to offer this immediate short-term interim care measure to address the young person's mental health needs. So if this is a problem identified within your organisation, here is a few tips that may help. Find out localised provision and resources available around mental health local to where your setting is, and have these list of providers readily available to signpost young people to. And this list can include lots of online platforms which have some wonderful resources for young people, such as Young Minds, coof.com or themix.org, should they be unable to access that face-to-face provision at present. Keep the topic of mental health alive in your organisation and evidence how you respond, report and record concerns within your policies and procedures. Schools themselves may have a mental health lead that could help work with external partners around strategic responses to mental health. Provide interim spaces or one-to-one opportunities for young people in your setting to do check-ins or touch base with should they be struggling with their mental health. But ultimately, never underestimate the power and value of feeling listened to. Providing a safe space for others to express and process their emotions is the foundation on which young people can begin to explore, attune, and form strategies of self-regulation.